is that diagnosis test for leprosy is nasal scraping. Nasal scraping for leprosy bacilli. Nasal scraping is a similar diagnostic tool for leprosy, particularly to identify presence in the load of Mycobacterium leprae in nasal mucosa. So, in this way, we diagnose the Mycobacterium leprae. Next question is isotonic isometric contraction. Isotonic is different by heat production. Okay, so another one is about collagen fibers that is stained with eosin dye. Collagen fibers are stained with eosin dye while others are not. So you have to memorize and claim this one. Another one is main gun injury, lateral side of upper leg. He is unable to dorsiflex. Dorsiflexion is performed by common peroneal nerve because of fracture of neck of fibula. So common peroneal nerve at the neck of fibula is present. So there is an inability to dorsiflexion of foot will be there, dorsiflexion. Now, as you can see here in this image, there is a nasal scraping test. We do nasal scraping test to find Mycobacterium leprae in this way. And now look at the neck of fibula and nerve to clear the concept, like neck of fibula nerve presence. Neck of fibula nerve damage results into the foot drop. Common peroneal nerve is there, and lateral side of leg damage can result into that. So as you can see here in this image, there is common peroneal nerve at the neck of fibula, that's a fracture, and then there is peroneal nerve damage results in a dorsiflexion inability of the foot. Next one is true regarding blood brain. The brain blood supply is number one, middle cerebral artery supplies foot. Excuse. Okay, so middle cerebral artery supplies foot area. Artery don't anastomose on surface of the brain. No, that is not right. Next statement is like here we can see. Okay, so this one. Artery don't anastomose after entering into the brain substance. Yes, that's the correct answer. Arteries don't sub. Another one is inhalation agent which increases cerebral blood flow, which is halothane. Halothane increases cerebral blood flow. Next one is a woman with involuntary movement, space occupying lesion in the caudate nucleus. Most common clinical features includes caudate nucleus lesion, intentional tremors. This is the Parkinson, but intentional tremors with uh, is the feature of known as chorea. Chorea is okay. So as you can see in this picture, there is a typical presentation of the chorea. Like patient will have abrupt, interrupted speech, and there will be shivering of the hands and inability to maintain the posture and movement. Involuntary association will be there. So a space occupying lesion in caudate nucleus, and the patient will have intentional tremors, involuntary movement, that is known as the chorea. So in this way you can differentiate about. Okay, so another one is narrowest part of airway in neonates is cricoid. Cricoid is a cartilage which is the narrowest part, ring-shaped hyaline cartilage in the larynx, form complete base of larynx and securing airway. That is cricoid cartilage. It is the narrowest part of the neonate respiration. Next one is most common cause of increased bleeding time is aspirin toxicity is the most common cause. Like von Willebrand disease is not so common. Hemophilia is also not that much common. Von Willebrand disease is not that much common. Hemophilia is also less common than aspirin toxicity in increase in bleeding time. So the question was narrowest part of the airway is cricoid cartilage, which is here. As you can see from up above comes downward. This is the narrowest part. That is known as cricoid cartilage, which is narrowest part for the airway.